Right, so if someone does have a tight psoas, okay, even if they don't, okay, it can be weak and full of trigger points. Okay, so it's a good idea to go in, do a little bit of soft tissue work. What I can do here. So you can let the leg relax on my knee. And I know the psoas runs from the lumbar spine to the lesser trochanter, so it's at this angle, like that. There's the belly button, there's the stomach muscles, and there's my doorway inside there. Fine. So, slowly go in. If you feel the aorta, the pulse, go slightly lateral, come out and go under. Okay. And all I'll do now, so you lift your knee just a little bit towards me, come up, yep, and relax. Slowly come up. And you'll feel the psoas jump under your fingers. Okay. And all I would do in this position, I lock the psoas gently. Okay, let your knee go towards the window. Very good. Let your knee come towards me. Very good. I can come out. I can move higher up. Sink into the psoas. And I'll do this with my fingers. I pull towards me. Okay. Move straighten your leg. Very good, come back. Slowly come out. So I'm using the leg as a lever. I can use the arm and the leg. So third, you're going to move your arm up like this and your leg away from me. So let's sink in. Lock the psoas. Very good, and together. And stretch. Fantastic. And together. Very good. Okay, so don't go too deep. You don't have to touch someone's lumbar spine to affect the psoas. Gently lock, get them to move their leg, you can feel it jump, and then use the levers, the arms, and change your angles. Okay? There are lots of blood vessels, lots of nerves. Okay, it's easy to cause someone pain going too deep into here. Be gentle. Okay. A nice softening technique. You can affect both sides, all the muscles that cover the psoas, the superficial muscles. So it's pushing and pulling, it's equal and opposite. Okay. And then you can go back again. You can work a little bit deeper, again using the arm and the leg as a lever. If I go into the side position now, working with trigger points, the psoas can refer to the front of the thigh, it can refer into the backside and into the sacrum. So a nice technique is to loosen up trigger points, fascia. And also, you are stretching the joint capsule and you are lengthening the psoas. Yeah? So people will often get pain down the front of their thigh. It can be the femoral nerve. They can get impinged by the psoas. Okay. I can go into the side position. Using reinforced fingers onto the lumbar spine and into the belly. I affect the tissue on top of the psoas. Yeah? So this is polarity. It can be trigger points in the hip. trigger points in the QL. Push, sink, pull, open. Push, sink, pull, open. And a very good stretch for the psoas. So of course now this is the psoas on the bottom leg. You get your client to support their leg, don't let it move. As soon as this leg moves, stop. Right. And now I push the heel gently towards the sit bone. Very powerful stretch. Okay? If you want to make it a little bit more intense, get the front lines. Don't look at me. And stretch. So you're getting the entire psoas, you're getting the whole front line. Okay, you can't separate the lines. You're getting the recfem. And this can also become a home exercise. Just remember, the psoas, all muscles work reciprocally. So if you do have a psoas that's dominant and tight, okay, you have to turn on the opposite muscle to turn the psoas off. Because when one muscle is hard, another muscle is relaxed. So if the psoas is tight, what's weak? Only the bum. So if you lie on your back, please do it. Bend your knees. Okay, quite simply, hands flat. Push your hips up. Hips up. Push up. Very good. Up, up, up. Great. So we turn the butt on. The psoas has to release. And if someone truly has got a tight psoas, they won't be able to get full hip extension. Okay. So it's not just about releasing the psoas. It'll go back and become tight again. Strengthen what's weak on the other side.